education that is co-ed between men and women. We have what's called intensive outpatient, which is 9 hours of treatment a week. Basically, people can come 3 to 4 days a week. We are a very holistic agency. We treat trauma-specific issues. I know you were asking about the darkness to light. We see a lot of trauma with our adult population as well. So we also have what's called Seeking Safety. I know they do that at mental health as well, where we actually get in and try to help people find new coping skills, because we know that that is one thing that really contributes to recidivism, contributes to people coming back to the system, is not really having the coping skills to deal with what has happened to them in the past and what's continuing to happen to them in the future. So that's some of our programs that happen in our outpatient as well. We also have a domestic violence piece. We have representatives from My Sister's House that comes in and runs domestic violence groups with us. So we appreciate that as well. We have ADSAP. Our ADSAP is our alcohol responsiveness program. When individuals get DUI, ADSAP is a program that allows them to get their license back and do the treatment they need in that area. We have a methadone and Suboxone clinic. Methadone is an opiate replacement. A lot of times people get addicted to opiates either by way of pain pills, like maybe they were prescribed by their doctors and are just having a little hard time getting off of them because they are addictive. So the methadone clinic gives opportunities to be able to gradually detox in a safe manner. It is also the safest way to detox pregnant mothers. In their second trimester, we are able to detox pregnant mothers off of opiates with methadone. So that's one of our clinics. It's right on our campus. Also, we have prevention services, which our prevention actually goes out to Wando. They're one of the departments that goes to Wando. They also go to schools that people request them, and they teach all about alcohol and drugs. They do groups and assessments with our community. TBS, which is Therapeutic Behavior Services, it is our child program. We have a program on campus where mothers can bring their children up to age 5. And the inpatient children actually go there during the day. So while moms are in treatment, the kids are also in treatment. They're doing art therapy with the kids. They're like doing speech and different things to help them kind of develop. These babies have been exposed to drugs or they have not. So it doesn't matter. But we want to be able to serve those kids too. We also will allow kids from the community to come to that, even if their parents aren't in services as well. Last but not least, well, 2 more. We have adolescent services that meets in the afternoons. After school is out, we are able to provide individual therapy to them and also group therapy. And like Chief Lucas was saying, we are in the detention center with our peer program. We have counselors, and there's a unit that is dedicated in the jail to substance abuse, where we're able to do groups and individual therapy, teach about community, responsibility. It's a great program, and it's been up and running since 90.
No, since I've been there. I think we did it in about 2006. There's only about 6 in the country that are like this, that have a unit, one whole house unit, nothing but substance abusers. And they do a great job with it, and the rest of the jail too. But they took the ball and ran with that.
A summary of our one thing that I want to say, like as I heard us talking, we have a vast range of referral sources. People come to us from DSS. They come from the detention center. We're in the process of transferring a pregnant mom over from the jail directly to us. The family said we're not going to bail her out till her bed is ready. In the process of that, we protect an unborn child, and we also get someone straight from the detention center into treatment. So those relationships do happen, that communication is happening. However, again, we can't force. So people are in different stages of change is what we call it. So some people are more ready to start to engage and start to make those changes than others are. But we also have some legal motivating factors, which, I mean, external factors could be great motivation. We have probation officers, so the idea behind it is, even though someone comes into services or comes in to get help, unwillingly at first by someone else nudging them to do so, there still can be great benefit from actually coming and getting help that they need. So, any questions about the Charleston Center, the services that we provide?
You are a county funded
We are.
organization.
We also have outside funding. We take insurance, but we are a county. Thank you. We are a county organization.
We're not providing meals down there.
At the Charleston Center,
Right.
in our inpatient setting, but not on an outpatient.
And that's one of the things the jail has been doing for a long time, again, to keep costs down, rather than them having to pay for meals. We provide the same meals we give the inmates, we provide them. Thank you so much. I was trying to avoid this, but
Well, we put it right in front of you. Yes, sir.
What type of follow-up service is done once the people, like a pregnant lady who's coming to you, what type of follow-up service is done once they've left the facility?
We have, actually, our women's and our adult programs are what we call continuums. So the inpatients, you don't have to just be from Charleston. Charleston County residents have priority, but at times other people from other counties come. So what happens is it's a continuum. So they start in the inpatient and we transition them into the outpatient. For instance, the lady who went into the house that Mount Moriah has, which is called the House of Ruth, when she went in yesterday, she is going to continue to be an outpatient with us. She'll probably stay outpatient for, it depends on her progress, but I would estimate up to 3 months.
Okay.
If she's progressing well and making her classes, and we also provide case management services for them. So it's not just a, hey, how you in services, bye, see you later. We follow them, we provide them support as long as needed. Some people will keep their services open and they'll come and just do a check-in, hey, how things are going. So we follow them through case management services and also through outpatient services.
Does this include home visitation once they have gone?
We don't do home visits unless there is a need. Or we used to have a program that was specifically for that. It was intensive family services. We don't have that program anymore, but if there is a need, certain departments can do home visits.
Okay.
I've got a suggestion. I've got a son that's autistic. He's 27, but he has the mentality of an 8-year-old. Was in school the whole time, mainstream, I think is what they call it, up until the time he reached West Ashley High School, and that threw him totally back because of the size. And because of the ACLU laws and so forth, they've got to be in the main population. So walking through the halls with 2,400 kids threw him back where he wouldn't even leave the house. We have had situations where he was sent to MUSC because that's usually where the schools send them when he would have an episode, especially at West Ashley. I'm recommending that somewhere along the line, officers are trained, even while they are in officer training or they go through some type of seminar, you have some of your people come in, not to just deal with drug abuse and psychotic episodes, but to learn how to deal with a Down syndrome child, how to deal with an autism adult, because they are two different spectrums.
Mm-hmm.
A lot of times they go to the emergency rooms and they're asking questions. One time I was in an automobile accident, the deputy came up, freaked him out because he kept asking questions. He has a speech disorder. He had the med bracelet on. They didn't read it. I told him he's autistic. Still ask questions that he can't answer. So he was getting agitated with my son. Hospitals are the same way. They do not, they've done wonderful training on Alzheimer's. I had a mother and an uncle 10 years in that situation. They know how to deal with different mental issues, but autism, Down syndrome, the main problems that you're seeing now, they do wonderful with little kids. But you've got autistic individuals out there as adults. There's no place for them to go.